in our program, and several callers that I'd like to get on the air. We're going to ask the callers to be concise, get to the point. We'll get the answers as quickly as we can as we move to Peckville and welcome Dr. Long to the program. Doctor?
About me?
Yes, sir.
Oh, okay. I just want to thank you, Mr. Bob Butts. He's my hero. He has spent over $350,000 out of his own pocket to spread the word of WaterCure. And the reason I believe in WaterCure is when I look at Dr. Doreen Day. Are you familiar with Dr. Doreen Day? Who has advanced breast cancer 9 years ago, who cured our own breast cancer without surgery, radiation, and chemotherapy.
All right.
And with the help of the WaterCure.
All right.
Okay, when I saw the videotape, I became a believer. I have used WaterCure successfully in my practice for people with high blood pressure, back pain, asthma, depression, and obesity. And I remember one patient with an asthmatic attack, and I admitted her in the hospital, at the Mid-Valley Hospital, and I treat her exclusively only with salt water. When she went home, she continued to take water and salt. As long as she's on water and salt, there was no asthmatic attack whatsoever. She didn't have to use an inhaler, no cortisone,
all right, Doctor. Yes, and we've heard that from Bob and Dr. Batman Gelage. I do want to again remind the callers that we are short on time. I'd appreciate it if you get to your point, your comment, or your question, and that's what we're going to ask Paul to do is with us in Carbondale tonight. Paul?
I read an article in the paper last week in New Brunswick, New Jersey, that there was a man who died from water intoxication. Now, I've been drinking 8 glasses a day. I went to the Internet, and there are a few sites on that. I just don't understand why this has never come up, pushing 8 glasses of water for years, but the danger of intoxication was never mentioned.
All right, let's go to water intoxication. What is it, Dr. Brown?
Well, you can't drink so much water that, as the one caller pointed out, her potassium fell to a low level. The sodium can also fall to a low level. You can essentially dilute yourself out. You really have to work at it to make yourself water intoxicated if you have a normal heart and kidneys, because, again, the homeostatic mechanisms in the body will essentially eliminate that. You'll turn off any diuretic hormone, and your kidneys will start pouring free water out, and you'll get rid of it, and you maintain a normal sodium and potassium level. But you can't overcome that by overdoing this.
And you've already mentioned, Dr. Batman Gelage, that it doesn't necessarily be 8.
This is actually a case of an athlete who had run and had become completely dehydrated and continued to drink 3 gallons of water.
So too much of anything, again, more common sense, but too much of anything is not necessarily a good thing. All right, Kaz is with us in Sugarloaf. Bob, I know you want to talk, but I want to try to get all the callers in also. Kaz, welcome to the program.
Thank you. I have a question about the water itself. What type of water are you talking? Are you talking about water straight from the tap that possibly has chloride and fluorine and pesticides and other things in it? Are we talking about drinking distilled water? Are we just talking about drinking mineral water with a high mineral content? What exactly?
Whatever water you are comfortable with.
Well, and Dr. Batman Gelage, Kaz raises a very good point, because one of the parts of Dr. Valentin's study actually raised the issue about the contaminants that are in water today, and the fact that the amount of water exposes individuals to carcinogens just because the fact that they're in the water. So, is there a handoff?
I don't buy the idea of carcinogens being the primary cause of cancer. I think that they are primarily dehydrated, and then chemical becomes an overload. Naturally, you don't want to drink any water that's contaminated. You have to become intelligent and put a filter on the faucet of your kitchen and get rid of all the contaminants.
All right, Bob, I know you want to say something.
If blonde doctors use the same logic of mainstream medicine, brown grass would be considered an incurable problem because no drug or procedure could cure it. And I think that kind of explains it out, because that's where it is. I know what I see every day with people. I have no financial agenda. In fact, we pay people if we can't help them free. Now, I'm not a lunatic. I don't like to throw money away.
No, and I know you're not, and I know you're a strong proponent. But I do have a question, and it's going to be a poignant one. And I ask you to consider it in answering. If in some scenario a member of your family, a close member of your family, contracted an illness, a potentially fatal illness like cancer, and they chose, to treat it just with water, what would your response be? Now I'm asking, this hits home.
I'd say you're pretty intelligent. Because there's no way in the New England Journal of Medicine, October 1986, the long-term survival rate remains an abysmal 3% using orthodox methods of cancer. Now today you'll hear these high figures, 40% or whatever it is. But if a person lives for 5 years, that's considered a survival. If that person dies 1 day after 5 years, that does not affect the survival rate. I'm talking the New England Journal of Medicine, October 86, 3%. Can you imagine taking your car to a garage with 97 out of every 100 cars went in the junkyard?
All right, but Bob, you as a caring parent, if your son or daughter had contracted cancer, okay, and again, I God hope it doesn't happen to you, wouldn't you want them to have the benefit of every potential medical avenue, including radiation and chemotherapy?
Absolutely not. Absolutely not.
I wouldn't do that. I wouldn't.
Dean Burke, one of the founders of the National Cancer Institute, he says chemotherapy is fraud. You can look it up. One of the founders. He said, keep in mind they can design research to prove daylight doesn't exist. Very famous MD.
So, doctor, if you contract it, you wouldn't?
I wouldn't. I definitely wouldn't. I wouldn't contract it because I know cancer is caused by dehydration. I understand the mechanism thoroughly. I presented it at this conference in 1987. I've researched it ever since then continuously. And today, more than ever, I'm convinced that cancer is a state of dehydration that arises as a result of long-term dehydration when the immune system is suppressed.
All right. Now, doctor, I'm going to ask you this question in a slightly different way. I'm your patient. I come to you. I have, you tell me I have cancer. And we start the regular treatments. And 6 months down the road, I say, I don't want to go for chemo anymore. I don't want that radiation anymore. I want to just drink my water and see what happens. What are you going to tell me?
Well, I would say that I'd need to see good data that showed that water was as effective as some of the chemotherapeutic regimens. And some chemotherapeutic regimens, I believe cancer is a delicate balance between the immune system and the cancer cell, which I'm an infectious disease doctor, and cancer cells have a lot of properties that bacteria have, and the immune system tends to deal with them in that way. I think that the goal in cancer therapy should be to destroy as much tumor as you can while maintaining as much immune function as you can. By taking away tumor, you enhance the ability of the immune system to control the tumor, and on the other hand, you preserve that immune function. So I think that's the goal of chemo, and that's why they do studies. And the chemotherapy regimens now have shown good results in reasonable results in patients that were blinded, and some got the treatment, and some didn't get the treatment, and that's why they're approved for use in.
Dr. Lorraine Day developed cancer of the breast the size of a grapefruit sticking out of her chest. She knew that chemotherapy is no good for her. She went into alternative medicine, started changing lifestyle, diet, took out caffeine out of her diet. She did a lumpectomy, but all the secondaries under her arms were still there. And she started on the WaterCure, and within 6 months she was totally free of cancer of the breast, and she testifies to that herself.
I've seen the same thing.
In fact, she advocates water on a regular basis as a primary treatment of cancer of the breast.
Pure insanity doing anything any different.
All right. Now, but there are cases, from, again, the research that I did in preparing for tonight's program, where actually too much water or water can dilute the effectiveness of some, and not necessarily cancer, but of the chemicals or the drugs that are using to treat some illnesses. So in some cases, water is actually bad for you.
No, I dispute that statement. In most cases, water is good for you. I don't think that, if you give the right...
in most cases.
No, the ones that you say they're bad, it's not. It's actually good for them. Because most probably, I don't know what cases you're talking about, most probably that condition is a state of dehydration. All you need to do is to give them the right minerals, you give them the right amount of water, and give them a balanced food, and the body will repair itself.
All right. Well, we are out of time. It has been a very quick hour. I do want to thank all my guests for being with us here. I am sure, could do another hour with the phones full and with these three gentlemen. I do want to thank Dr. Robert Brown, Dr. Batman Gelich, and, of course, Bob Butts, who are all here tonight to talk about the WaterCure. A reminder